Here, I'm Sandra Ezekwesili, and the 5 p.m. news update means it's time for the big hard fact. From now until 6, let's dive deeply into cancer. Today's World Cancer Day. It's a day that the World Health Organization has set aside for us to raise awareness about cancer and to reflect on all our policies and strategies for fighting this group of diseases responsible for so much pain, so much death, and sorrow in the world. Cancer kills more people every year than malaria or AIDS. It attacks both old and young, rich and poor, and it's one of the main contributors to reduced life expectancy worldwide. And this is why the United Nations, through the World Health Organization, is so committed to getting member nations to fight cancer ruthlessly. They decided to shine the spotlight on a heartbreaking issue that affects so many people here in Nigeria. And today's big hard fact is that according to the Ministry of Health's National Cancer Control Plan, cancer kills 72,000 Nigerians every year, with an estimated 102,000 new cases annually. It's a very sobering statistic. It means that cancer kills 6,000 Nigerians a month. That's 1,500 a week. That's almost 10,000 Nigerians every hour. And that's why the theme for this year's celebration is so important. Today's theme is I am and I will. The idea is that there are actions that each and every one of us, whoever and whatever we are, can take. And if we will take them, we can help defeat cancer. We have a guest on the show today who is so knowledgeable about what we can all do to fight this menace that cancer is.
Absolutely. So we have Dr. Olalekan Makinde, medical practitioner, and we're going to be having a conversation with him. He's been on the walk. I did hear him this morning on Morning Crossfire, just as he headed out together with the representative of the wife of the governor of Lagos State. And then I caught him downstairs also too with a group of young doctors who began the screening exercise also too, which is very important. Just something Sandra talked about, the fact that the numbers of deaths in cancer, I mean, it really strikes home hard, because almost everyone has known someone who's passed away from cancer, and also knows people who are probably going through the pains of chemo or any of all those interventions just to make life easier, and it's never an easy task. But Dr. Makinde, great to have you join us on the Big Hard Fact.
Well, thank you for having me. But I want to start by saying that those statistics are underestimated. And that's why I said in the morning, in Nigeria, we don't get some of the statistics. A lot of people don't have access to healthcare, access to facilities to record anything. A lot of people, when they're sick, they don't do any tests. So there are a lot of people that we miss in the statistics.
The data gathering.
So even the data we are talking about, everybody, 10,000, they are still underestimated. There are more. So we need to do more to prevent these things.
Wow, that's quite scary. So some observers outside government have said that there are numerous reasons why people do not go and get tested, do not go and find out what it is exactly that they have. Do you know what some of these reasons are?
Yes, I think the most important one, and that's why I'm here today, is ignorance. That thing is secondary. People, if you understand the value of these things, you will do it. People don't understand the value of doing a check. Somebody feel, once I don't have a headache, I don't have a fever, and I keep on saying this thing. This is the way a lot of people are still thinking. And I said to people that if you think this way in the year 1800 or some stone age, 1900, you'll be fine. But in year 2000, 2019, 2020, you're still thinking about health in terms of, I'm feeling okay. You ask somebody, have you done the checkup this year? He or she tells you, I'm okay. Who tells you that? You might have a stage 4 cancer, and you know. You might have. I went to a village once, and I was taking BP from a woman. I know the BP machine is maybe it's about 300, and the 300 finishes, and the BP was still on. That means her BP was more than 300.
Wow.
So, and she was still fine, eating something on one hand, and then talking to someone's story on the other hand. So these things, I'm very passionate about talking about non-communicable diseases. A lot of people don't know anything about it. Even executive, even people that are highly educated, they think that these things are just something in the books until when it comes to you. Now, cancer is killing people. And I said in the morning, 17 people die every minute. Every minute as I'm here now, maybe 2-3 minutes, 17 times 3 already dead due to cancer. And why is it important that we talk about it again? Now, this death we are talking about, more than 80% documented, even from the world we have shown that we know now that more than 80% of these deaths are taking place in low and middle income country, which Nigeria is a major part of. So many of it are taking place in Nigeria. And if you're talking to people, just do a random study or random with a lot of people, there's hardly anybody today who does not know somebody or a relative who has died of cancer. So it's not far away from us. So people think about cancer as something that for the rich, and no, it's changed. It's a change basis. It used to be a disease for the rich, but now it's happening more to the poor.
And so now, for example, we know over the years that we've been able to streamline the sort of cancers that are common for the screenings to go. There's the breast cancer, the cervical cancer, and the prostate cancer. I do know. Has the narrative changed, or is we're still dealing with these three main?
Yeah, that's what we deal with these three at the moment. For us, I think those are three major ones, and the one we can easily deal with, and that's what we're looking at it. For instance, I'm aware that in 2018 alone, I've not gotten last year statistics. Cervical cancer and breast cancer killed almost 2 million people each. 2018 alone, just that one year.
Globally?
Yes, globally. So that tells you that these things are still there. And the truth is this, especially for cervical cancer, the incidence or the prevalence is reducing maximally in the developed world because it's easy to deal with, just like what we're doing today. We've done a few screening today. People came in there, they thought we were joking. This is free. We're doing it free. You know, it's actually quite expensive. I can tell you, maybe up to 25,000 to do one. But we're doing it free for people. Anybody walking in, and then you do your screening, and then we'll get to the result. So we do this thing for people. And if you do your pap smear, for instance, like we have educated people a number of times. Cervical cancer, for instance, takes about 10, 15 to 20 years to fully develop. So somebody have had over 20 years to have prevented a cervical cancer, but the person never took the opportunity. The person was waiting for him or her to have a headache or a fever.
How often should they do a pap smear?
The pap smear should be done at least once in 3 years for premenopausal women. That means women that have not gone to menopause. Now, before the age of 65, you're supposed to do it at least once in 3 years. But when you get to 65 years and you have been doing it regularly, now you're now advised to do it yearly for about 3 to 5 years. After then, you don't need to do it again. But if you're somebody that have never done it before, and then you get to 65, you will not be able to have that. But if you've doing it before, at least minimum of once in 3 years, and by the time you get to 65, and then you've done it 2, 3, 4 times, then you don't have to do it again. But there are many women listening to me now who have never done one. They never had the time to do it. That is one thing. People think that they are too busy. You think you are too busy until when something happened to you, you now know that you're not busy. Because that job or that work you're running after, when you pass on, somebody else take that seat the next day. Sometimes they like you, they keep for 1 week for you or a month. So you need to understand that if you are not healthy, health is health is wealth. We need to be in our health. And I'm very passionate about this. I need to Nigerians to think about health in terms of prevention, not cure. And that's why our program is titled Prevention, Not Cure. Don't wait until when things are very bad. Like I said in the morning, for instance, statistics have shown that people who had breast cancer and it was detected in stage 1, nearly all of them will live. Nearly all. Okay, stage 1, early stage 2, more than 80% will live. They will not die because you can just deal with it and all that. But once you cross to stage 3 and stage 4, that's it. It's almost impossible. It's almost sure the person is going to die. Maybe also just about 10% will live by the time you get to that level. So we are looking at early two things we are doing, and that's what we are doing with this program. Number one is for us to create awareness. And information is everything. Education, knowledge is everything. People to know what and what is not. This morning, somebody was sharing with us while we're outside the studio that a parent called him and was complaining that the teacher in school asked the son not to drink soda. Now, who is that teacher? It's the son. You can drink anything. But I'm sure the teacher is maybe listening to us, and she knowledge myself. You can't be taking this every day. How can a small child with that small body taking that big bottle of soda every morning? I know those are the things leading to cancer in the next 10 years. It will not happen today. No, it's about what I call the people of seed, time, harvest.
I know that we don't have the numbers in Nigeria. We don't have the data because we don't have people presenting so that the data can be collected, and a lot of other reasons why we don't collect data. But do we know which cancers are more common in Nigeria as opposed to other parts of the world?
Yeah, that's what we're dealing with. We know for the women, for instance, it depends who you are talking to. If you are talking to the general surgeons, for instance, they will tell you that breast cancer is the commonest. Because that's what they deal with. But the gynecologists will never accept. This is our own internal thing. The gynecologists will say, no, it's cervical cancer. So both of them are quite like that, breast and cervical cancer for women.
Okay.
And it's easy for you to know because if you ask around, most people who have died of cancer is
breast or cervical.
And then for the male, especially now for the elderly. No, it's more of prostate. So it is said that if you live long enough, you will have a problem with your prostate. So either a benign, it doesn't have to be a tumor. Yeah, like I said in the morning, it doesn't have to be a cancer. Like I said in the morning, a growth in the body, a tumor can be benign, it can be carcinoma. So you can have a benign growth of a prostate. Okay, that we call BPH. So if you live long enough, you're going to have it.
Okay.
But for some people, it's not just BPH, it's now a cancer. Okay, so that means that everybody is at risk of it. So that's why you have to check if something is happening there. Now, for male, those days we look at more at the elderly, above 60, above 70, and then. But today we find out that things are getting. We are seeing younger people. Younger people present with these things. So those days, for instance, when I do screening, I've been doing screening for a long time, 25 years there. But when you go for a screening, you see a child of maybe a young man of 20, 18 years old. Don't worry about him. Just don't do the BP. But we'll do that again. Now we find people 16 years already having high blood pressure.
Wow.
Yeah, it's getting like that, and it's easy to understand why. Lifestyle
history.
Yes, and everything. So it's a different world now. Today we know people don't want to go natural. They want the things are natural. The things that are synthetic, whether I like it or not. So if you put a lot of synthetics in your body,
Is that what triggers cancer?
yeah, that's what just trigger. That's what lifestyle. Now, if you go on the WHO website, 4 things is there everywhere. You see the 4 major things have been indicated as some of the most important when it comes to cancer and NCDs. Number 1 is food and diet. Eating, the kind of food we eat, how we eat it, and all that is very important. Number 2 is physical inactivity. When people don't have a time to exercise and all that, I don't have time to they just go to work and live in AC house, AC kitchen, the restroom have AC, everywhere AC, and then nobody's sweating it out again, like the days of our fathers. They say we'll go to the farm and then you walk a long distance. No, but we don't do that. So that's number 2. Number 3.
But our fathers also had cancer. They just didn't know it was cancer.
Not. No, they had cancers, but it was very minimal, not this rate. If you check the trend, I can draw the graph for you. If you look at those days, non-communicable diseases in Africa was down here. Okay, the infectious disease was up. Okay, I always draw the graph, but today it's going like this: non-communicable disease is going up, infectious disease is coming down. The only spike we have in infectious disease now are all this coronavirus, Ebola, Lassa fever, and all that. But it just spikes and it's still going down in a way. But for NCDs that people are not taking care of, is going up like this. We have a lot of it happening to a lot of people without them knowing that they have non-communicable diseases.
So in terms of action against cancer, we can group them into categories, right? So prevention, like you've been talking about, and treatment. And for each of those, we also have awareness, right?
Yes.
Now, I want us to look at all of them in turn. We'll start with prevention. That we've heard of people who, like you say, have a healthy lifestyle. They're eating right, exercising, and yet they get cancer. So some cancers obviously can be prevented and some cannot. Which ones can be prevented and how?
Okay, we can't really say that these are the ones that can be prevented and these are not. There's a lot of factors. When we talk about prevention, that's why we don't just say, oh, you do this and then you are free for life. Okay, it's just that risk level either increases or decreases. They also, you have to understand that we are different. We have different genetic composition.
That's right.
For instance, if your parent had breast cancer before, your mother, from research.
So in my case, my father had colon cancer.
Okay, so most times like that means there's a risk for you. Most of the cancers, the children, and for breast cancer is even worse. If your mother has a breast cancer, for instance, we have about 4 times more risk than anybody whose parent doesn't have of a breast cancer to have it. So it's like that. So those are the factors. So if the lady already have all those things, she had BRCA2, BRCA1 in her system, these are the genes for breast cancer and all that, and then she still does lifestyle, she might still have it. But most times it will be later than what she have had. So understand what we're saying. What we're saying is not that if you do prevention, it's just we are all free. But it's even if you're going to take a longer time. It's about you have a fire, then you put a lot of wood in it for it to burn. So when you're doing prevention, that you're removing the wood, most time you might be able to remove all the wood and the fire might go out. That's why most people that have done all the prevention, a lot of them live healthy. I've seen so many people like that. Even when their parents had all these things, but because they knew from day one, like I know today, there's somebody in the National Diabetes Association who I know very well. All the siblings were diabetics, but he's a professor now, and he's almost 70 years. He's not diabetic. Why? He knew from a very young age, and he has taken all the precautions. But now he's not diabetic yet, and it might not be. So prevention is very key. It has been said that if you do prevention, and then all these things, you will be able to prevent at least a minimum of 1/3 of all the cancer and the cancer death. A minimum. And then if you do early detection and treatment, you can prevent another at least 1/3. So out of, we're talking about 17 per minute. If you do all this prevention, we'll be able to prevent at least maybe up to about 13 of it. With all these things we are doing. They sound simple, but these are the things. People think, when people think about health, a lot of people think about it in terms of drugs. But people don't know that's not it. Health is beyond that. In the definition of health by WHO 1946, if you read it, you won't say anything about drug there. There's no drug. So when people look at me and say, doctor, I need drug, I don't look at them. I'm not doctor giving you drug. I want to live healthy. That's the first thing. Drug is not the first thing in medicine. Okay, it's the first thing is for you to live healthy, and which is what we're talking about for this work.
And living healthy involves cutting alcohol, cutting cigarettes,
all that, alcohol, cutting cigarette, exercise, and all that, eating healthy, and all that, and things
but
like
how
that.
can we eat healthy when fruits are expensive? Have you tried to buy fruits in Nigeria?
Yeah, are they really expensive?
They are.
Sometimes it depends on how you look at it, and they also depend on how your priority. You could get to buy them from them in bulk. Do you know that even in this Lagos, there are places where they sell fruit in bulk very cheap? I know.
Where? Give us tips.
Is the distance you have to travel?
The markets
Give
are
us
there.
the
Good.
scoop.
Where
Where?
It's not the market on the island now. You have to go down
On the
certain
mainland.
places.
Okay.
Good.
I think I know some place in the
And then you
mainland.
get
I don't
back
know.
and come back.
Something like that.
Mile
If you
12,
calculate
maybe.
the transport
In the morning,
cost.
sometimes they're doing a lot of banana there. I've seen it a few times when I drive down there, and they're selling it cheap.
Where?
And in my 12 there, you get a lot of banana there in the morning.
So I start going to Mount 12.
Oh, I'm sure there are other places when the interest increases, and then we can get all that.
So
And when you're traveling on the road, remember there are a lot of people selling fruit. You buy those things and put them in your boot.
maybe you just relocate to save yourself.
Abi?
Dr. Makinde, something I wanted to also point out. While we've been conversing and having this talk around the World Cancer Day, many of the factors that have been mentioned are also directly linked to the ways that we can prevent them from happening.
Yes.
Lifestyle, for example.
Yes.
The genetic question also too also predisposes people. If your family, for someone in your family had cancer, likelihood, and we can work around that. But there are also things that I'm not too sure whether we have control over. There have been research and studies about about environmental pollution.
Yes.
And the way it's linked to cancer. That's directly out of our control.
I agree with you. That's why when you talk about the factor, you usually classify them to two: the modifiable and the non-modifiable. So we always do that in most of this NCD. I'm talking about environment first. I'm very interested in that. I'm actually interested in environment as a public health person. For instance, even me driving down around Lagos sometimes I get very upset by what people do. For instance, some of them are not here or there. For instance, electricity. And then I see a lot of people buy some generator with so much smoke. Sometimes I think people don't understand what they're doing. I would prefer to stay in the heat sometime than use some of those generators people are using. I know houses where they put generators, so much smoke is coming out, so much noise. People don't understand that you are destroying the environment. It's a lot of things. But people don't know. They feel, I'm okay, just whether I can make some noise and then I can have electricity. Sometimes you have to look at the cost-benefit effect. That's the truth. Sometimes I think we need to do more education on this as well. So we're having more pollution in the environment, CO2, CO, the greenhouse gases and all that. These are also things contributing to cancer. Then also occupation, like I said in the morning, there's some occupation that also contribute people to cancer. For instance, working in dye industry. Anybody listen to me, working in dye industry, you have to take a lot of precaution. You are predisposed to things like bladder cancer and co. It has been proven, bladder cancer and dye industry. And there are other places, people that work with where there are radiations, all kind of radiation, people are there. And then a lot of people work in the places where they are supposed to use protective gear, but they don't use it. I used to do a lot of occupational health visits, and I go to factories, and you see people eating in the midst of and so much noise and all those things, and then they're going to wear some overall. They will not wear it. They feel it's causing me heat. They don't understand that the person that has to wear that thing know that if you don't wear it, you are exposing yourself to some things and all that. And also radiation. So even using all these X-rays and all that, mammogram, even mammogram itself. We're talking about checking for breast cancer with mammogram, and that's why even in the teaching today, women that are less than 45, you want them to do more of breast scan. Then women that are more than 45 do more mammogram, even in our teaching today.
What do you mean breast scan with an X-ray?
Yes, there's local breast scan with an it's a scan, not an X-ray, because we want to also reduce their
Exposure to
to
radiation.
radiation. So mammogram itself, actually, although that is not that much, so I should not emphasize that, itself could be a risk factor to breast cancer if you do it too much. So that's why, for instance, that's what we're doing for this World Breast Cancer Day. We are doing clinical breast examination, not mammogram. So other time we could do mammogram as well, because there are three things you do when it comes to the breast. There's what called this breast self-examination. So what we do in the clinic, that we teach women how to do their own breast examination. The truth is, if you are careful enough, you'll be able to see these things. Not just even your husband or the spouse. The truth is that many times growth and cancer and all that are detected by the husband or the wife's breast, and then report, and then we can do that. So breast self-examination, every woman should examine her breast. Let me say his or her breast, because men too can have
get
just,
it as well.
just about 2%. Okay, so examine your breast, and then every month it's yours. It doesn't belong to someone else. So you can do that every month. If there's anything there, let us know, or we can take it further. Then every year you have an expert like examine the breast. You can see it's called clinical breast examination, and according to WHO, that is what's recommended for screening, because it's cheaper and it's economical, unlike having mammogram. So and then the last one, which especially when there are high level of suspicion, is mammogram. But the truth is that nothing is 100% perfect. Even mammogram is not 100% perfect. So, but it's more, it gives you more results than if we clinical breast examination.
You know, under the National Cancer Control Plan, one of the prevention measures is, quote, integration of primary prevention into primary health care delivery.
Yeah.
So basically ensuring that at primary healthcare centers, people are given the information, the tools, and if necessary, medication to prevent various cancers, right? But the NCCP lists this as not started as of last year. What's the challenge in rolling out cancer prevention measures at primary healthcare centers nationwide? Do you know?
And one of the vow I made to myself is, as much as possible in my programs, not to talk about government. I don't want to get into all those things, because people start to put all kind of politics to things that are just simple things, all kind of sentiment. Some of these things are not rocket science. They are easy to do if people know what they are doing. But today you see people doing putting energy on what is not. Healthcare in Nigeria, it's something that can be. Nigeria healthcare system can be dealt with if you have the right people thinking the right way and put the right effort. It can be dealt with. So what you're saying now, if the people in the government see the importance, if they are convinced enough, they should put their effort into this. Look at what is happening in UK. The NHS is like the politics of UK. You know that.
Yeah.
Nobody go talk about your prime minister and all that.
Don't have
about
something.
NHS. Do you understand? But here, people just take it as if nothing. Then before you know it, the Nigerian president traveled abroad to take healthcare, the senators and all that. And each time I hear these things, I just to myself, please don't talk about government. Just talk to people about what they can do. And I'm telling you in my mind, what they can do. I want to look at people. Forget about the government.
All right, let's talk about
and
HPV
then
vaccines then, because another prevention point that the NCP recommends is the introduction of the HPV vaccine for young girls. So can you explain, how that works?
In the US, for instance,
how it can help?
that's has been put in place. Yeah, it does, because most of the cervical cancer is secondary to HPV, papillomavirus. So the vaccine, and it's available in Nigeria. We have the one that cover two variants of the HPV, 16 and 18, and these two are the one that cause almost 80-something% of the cancer. So it's called Cervarix, and it's Nigeria is available. We give to people. People come do their pap smear. Once you are negative, then you get your vaccine. But here you have to pay for it. The government is not paying for it. Well, in some places,
I
like
got
the US,
mine at the General Hospital when I was in Port Harcourt, and it wasn't very expensive.
Yeah, it wasn't. Not very expensive.
5K per shot, I think.
Yeah, something like that. Even here you can get something like that. But that's because you saw that as a priority. But some people don't see that as priority. They don't even understand. They don't even know what's happening. So if everybody knows that it's available.
So tell us. So you're here, and the reason you're here is for awareness.
Yeah.
So tell my female listener right now why it's important to follow in my footsteps and get that HPV vaccine.
Yes, because if you get the HPV vaccine, you reduce your risk of having cervical cancer by almost 90% or more than 90%. So HPV vaccine is available in Nigeria. It's readily available. You can get your screening. You have to be screened first, and once you are negative, then you can take the vaccine. Once you take the vaccine, your chances of having cervical cancer is very, very minimal.
Is there an age limit?
Usually, it's supposed to be taken. Normally, it should be taken before the person becomes sexually active. But today, because we know that we're not able to achieve much with that, it's has been said that anybody can take it. Once you even if you're sexually active, once you don't have the cancer yet, you've done your screening and it's negative, then you can take the vaccines.
Okay. All right. We're having conversations about World Cancer Day, and you're listening to Dr. Makinde on the show with us, and he's telling us so much about how we can prevent this monster. By the way, when we started the show, we told you that we have 10 Nigerians dying every hour, if we're going by the official numbers from the Ministry of Health's National Cancer Control Plan. And we have more questions, and I'm sure that you do as well. We'll also like to hear your experiences about cancer, your story about the disease, or your experience with your loved ones. Share with us after this break.
Hard Facts will be right back. Welcome back to Hard Facts.
Lagos, you're listening to Hard Facts on 99.3 Nigeria Info. I'm Sandra Ezekwesili. We've got Dr. Makinde on the show with us today as we're talking World Cancer Day with you. As you listen at work or in your home or in your car, I want you to call with your questions about cancer or with your experiences with the disease or the experiences of your loved ones. Cancer has touched so many of our homes, and we must not lose sight of the personal cost of this disease. I can tell you firsthand, as somebody who had a parent that I deeply, deeply loved deal with cancer. It's not a funny thing. It's not the kind of thing that you wish on your enemy. When it comes to cancer treatment, I want to move on to treatment now. When it comes to that, one big factor that determines the success or failure of cancer treatment is early detection. We've been saying that. Now, the NCCP's goal is for 40% of health centers nationwide to have cancer screening capability, and for 50% of Nigerians to have undergone cancer screening. Now, the target is 2022. I know you don't like to talk government things, but do you think that we are on course?
Well, maybe just visit one or two centers and you will know whether we're on course or not. Because I think at the moment our healthcare system is overwhelmed. That's the truth. And that's why after everything else we have to pray. For instance, now we're praying that coronavirus don't get in here. Because forget what some people are saying. I don't want to mention their name. I'm a specialist and I'm on ground. I can see what's happening. We are not prepared to combat these things. Yes. You can see what happened in China. In 9 days, they built a health center. In 9 days, and they're building the second one now. You can see how people could react to a disease and how they could contain it. And then we were lucky, and thank God, to Lagos State as well in 2014. And I was part of that effort to combat Ebola. So the health system now, I think we are not putting enough. We have to tell ourselves the truth. Now we had this meeting in Nigeria, and then they made this stuff. You have to put this amount to healthcare, 15%, and we've never gotten there. We are going between 4 to 5% of budget, so we are not investing enough into healthcare. The primary health center, you mentioned that primary health center, they need to be there. A minister came to Nigeria and he was talking about building primary center, and I was laughing at him because he doesn't know what's on ground. For you to say that, I know that he doesn't know anything about primary health care, because in Nigeria today, go to every local government, you will find primary health center, but they are being used by rats and dogs and serpents and all that. Why? They'll be abandoned. Okay, so it's not building health center that is the issue. It is getting them to function, getting them to have the personnel. And I don't want to go there, but I can also tell you, today I'm worried because I don't have medical friend in Nigeria again. Everybody's gone. And that's the truth. I'm confessing. I want to do one or two things. I find out, this person, he's gone. And this one is gone. Everybody's gone. Nearly everybody, because the pasture is green on that side. These are the things affecting our healthcare. We need to have primary healthcare on. We need to have... People don't have headache and start running to tertiary center, loot or last week. No, you should have a place around you where you could be assessed, where you can have. So these are the things. So check for cancer screening should be taking place at the primary health centers. People should be able to go there and so I want to do my yearly check, and should be able to do that, and then they are good to go. So these are the things we are supposed to be doing, and I hope somebody's listening and somebody can do something after all this talk.
Because when it comes to cancer treatment, one of the big challenges is a proper supply chain and logistics infrastructure. You also have that. You have lots of big complex equipment that need maintenance. You need electricity and other services. You need constant resupply of consumables, preservation of drugs and specimens.
Vaccines.
You need constant resupply. You need you need a Nigeria that as a developing nation isn't struggling with all of these things. Now you have the NCCP. I'm going back to them because it's World Cancer Day and they are our control plan group. Their target is that by the end of this year, 2020, we should have a robust nationwide functional supply chain mechanism for cancer treatment. Do you think that's feasible?
I love Nigerians. We like to speak grammar. Very big grammar. You know, when I was in medical, let me tell you one of my experience. When I was training as a resident, those days when you do presentation and then you don't see anything. So you say, oh, there's no policy on this, there's no policy on that. But I was shocked one day, and when we find out that many of these things has policies. Go to Ministry of Health, you'll see many policy paper. You know, we always go to the drawing table. I don't know what we're already drawing. Every time we go to the drawing table, we draw things, and then after a while, nothing works again. You know, so these plans are there, but who is pushing them? Who is passionate about it? The people that are there, do they want to do it, or they are just doing politics? You know, health is something that's, you know, if possible, take it out of all this politics. Let's face it, this is life. This is people either live or die. Okay. Now, for instance, let me give you an example. We talk about it. That's why in health cannot stand on its own. You know, there has to be intersectoral collaboration. That's one of the components of primary health care. So one of the concepts of primary health care. There have to be what we call intersectoral collaboration. Let me give you an example. We talk about, for instance, the vaccines. In vaccines, they have to what we call the cold chain. Okay, you have to maintain vaccines at some particular temperature. Now, do you know that if somebody just got angry one day, the person put off the electricity, and those vaccines, the temperature falls higher than that, the vaccines are going to get spoiled. Then they're already spoiled, and somebody put on the light again. Now you're going to be giving that vaccine to people all over the nation. What you have done is that you have wasted all those efforts because you've taken away the life of those vaccines, especially the life attenuated vaccines. So these are the things happening in this part of the world. You tell people to go and give vaccines, for instance, on the field. These are things we see, and I can tell you. And then the person goes there, collect the money, and then carry the vaccine and throw them away and all that. So this is the kind of thing we are seeing. So we are having this systemic problem that we're not able to find solutions to, and this is affecting us. So we cannot do cancer prevention if other things are not also in place. These things affect, for instance, talk about poverty, for instance. There's no way you can talk about healthcare without poverty. How many people can pay 25,000 today per smear, or 20,000 or 50,000, depending on where you are doing it? Okay, or the way you're doing it free today and tomorrow. So you see, these are the things. So people be able to afford healthcare. Healthcare should be made affordable. This is one of the goals of the WHO, but I don't know how they are able to push our government to be able to bring this to bear.
Yeah. Now, you mentioned personnel, and you mentioned that we're losing a lot of specialist doctors to immigration, including oncologists, and we didn't even have a lot of oncologists to begin with. Now, how do we hope to resolve the personnel problem in cancer treatment if we cannot attract the personnel to stay?
Well, that's why we are focusing on prevention.
So don't get it to begin with.
Don't even get to that level because, for instance, I don't know. I think now we have a PPP. For instance, I know in the Lagos Medical Teaching Hospital for a long time, which I'm aware of, the machines were not working. But I think they have a PPP now. Somebody is private public partnership thing, and then I heard of about 8 centers with those. I hope those things are working, because one thing to have the machine, it's another for them to be working. No,
so I remember taking my father to UPTH when we tried to get MRI scan, and we waited and waited and waited. I eventually had to take him to a private facility.
I worked at the National Hospital. I'm going to say this, and this is very pathetic for me. I worked at the National Hospital for months. I'm not going to mention the year. And for a long time, we didn't have a CT scan working in National Hospital of Nigeria. And we were losing patients. If I tell you, I cried every day when I was in that place during that time. Because we lose patients because this is top secret, but I was there. I know what was happening. If you have a patient that had an accident, then they were of accident because of the free road in Abuja. So once they come into the hospital, you are supposed to do a CT scan, but the machine was not working. So people now take them for what we call MRI. I'm telling you medical things now, and that's not appropriate for that. So we end up losing many of those people. And I'm telling you, I was in the system then. This thing was not working. Nobody fixed it. And we were losing people, and people are there in the hospital. This is the kind of thing we have in Nigeria today. And that's why people like someone like me don't ever want to work in the government hospital. I want to work for myself. I want to be able to take responsibility for what I do. I want to say, okay, I can do this for people, and then I'm happy. I can have a good conscience. I can work in a center where I know what to do. And this is now, why do people live in this country? Let me tell you something. A lot of people get doctors wrong. When doctors go on strike, they say, oh, they love money and all that. They don't know what they're saying. Today, if you go to our hospital, the doctors are contributing money to treat patients, their own personal money. I've done that many times. Why are they living? Many of them are not living because of the salary. They are living because there is nothing to work with. When I was a medical student, I can tell you some of the things that get you to cry when you remember. We've lost a patient before because we didn't have fluid that cost only 100 naira. in a center. So these are some of those things that get to you. You feel, what am I doing here? I know what to do. I know how to do these things, but I don't have what it takes. So
tools.
talking to the government, maybe I'll do it one more time today. We need to get these things working. No, we need to get at least some centers working. We need to put more attention to these things. Let's have basic things for doctors to work with in the centers. Okay, let these things be available. Let's have more beds. Nearly every time I get people calling me, I say, "Oh, can you talk to somebody in Lut or Lasut? We don't have bed." The beds are not enough. They are never enough. People need attention, but are we giving attention to them? No. The big men in quotes, once something happened to them, they are out by the next flight. And that's why I have said one of the things I've proposed in this country, or the day I believe Nigeria is serious, is the day we are going to make a law that anybody in government have to seek medical attention here in Nigeria. I think we have to get to that level for us to take things more serious.
All right, let's come to you who's listening in your car or at home or in the office. 012770993, 012771993, 012772993, and 012773993. What's your experience with the disease? What questions do you have about cancer? What are your experiences with your loved ones? Because cancer, like I said, has touched many of our homes, and we try to not lose sight of the personal cost of this disease. Hello, good evening.
Hello, good evening.
Welcome to the show. What's your name?
My name is Maureen Chadi.
Maureen, go ahead.
Hi, Sandra. Oh,
Hi.
I love you so much.
I love you too.
See, actually, my mom had cancer at 68.
Oh.
So, and hers was stage 3. But
Was it breast?
Yes, breast cancer, yes. Because
Okay.
when they removed the lung, it became contaminated, or how do I say, it became infected,
Oh.
started bleeding from that breast,
Oh.
So we had to fly her to India. We 5 children. We sold everything we had.
Oh, I'm sorry.
Just to make sure we took her to India. Then she went to India twice, came back to Nigeria. There was no radiation machine. We had to send her to Ghana. You see all the things we're talking about, not in Naira, they were all dollars.
Yeah.
That was like 4 years ago. Thank God she survived it. Three years after, so she's still standing.
She's still in
No
remission.
reaction, no remission. Yes,
Yeah.
yes. So they told we, the daughters, to make sure we do our own regularly, But the funniest thing,
What?
I did my own last month. I've been doing actually mammogram, but I was feeling pain in my breast. So I went to this hospital in VI, one big hospital there. I did it mammogram just last month. And after the test now, I went back to see. The doctor was just saying what we saw was benign, nothing to worry about. I said, no, that's not good enough explanation for me, So now my healthcare insurance has been cut off. So I don't know if I should go and do another mammogram because I didn't get the right result from those people, or I should do a scan. I'm kind of confused.
Are you over 45?
Yes.
Oh, okay. So I'll let the doctor
Stop
answer
hearing.
that.
Yes. Please, doctor, advise me. Should I go back and do another mammogram, or I should do a scan? Because I need to get the right result.
Okay, why do you think you didn't have a right result in the first place? I need to know why
The
you think.
doctor I saw was just inefficient because he was just blabbing. He didn't explain to me. I said, please, what is it? He said, what you saw is benign. How do you know it's benign? You break it down, talk to me. But the way he was behaving, so now my health insurance is cut off from that big hospital. So I have to look for money to go and do, either to go outside and do my own and get, I don't know what to do. I'm kind of confused because the breast is still paining me.
Okay, I wish I can see that your results. I don't know,
Okay.
but if I can see it, I'll know what to say. If I see
Okay,
that
what's your
result,
email
They
so she
won't
can
give
email it
me.
to you?
I did it in this big hospital.
Okay,
In,
I can give you my email or my organization email. You can
Oh,
send, you can send me a mail at info@canterburyhealthconsult.org.
info at Canterbury
Healthconsult.org.
Can you
Yes.
spell Canterbury?
Canterbury,
Yes, I can say,
yeah,
yes,
Mayor of Canterbury, Canterbury, yeah.
Canterbury, right?
Yes,
Okay.
yes. So you can send me a mail
I'll-
there. Yeah, I'll look at it.
Okay, thank you.
Thank you, Maureen. Thank you for calling. And so sorry about that experience you had. Hello. And all the best. I hope it's not cancer. Hello.
Hello, Ezekwesili, Sandra, and Shakuma to Aghogho.
Aghogho is not in the studio right now. Good evening. Welcome. What's your name?
Yeah, this is Victor calling from Ijebu.
All right, Victor. Go ahead.
I have a few questions for the doc in the house. I understand that this cervical cancer is caused by HPV and it is sexually transmitted. Now, if as a man you have unprotected sex with a lady that is positive with this virus, will it be transmitted to the man? And two, what other disease or illness could be caused by this HPV?
Okay.
And if such disease affects men,
Okay.
can a man get the vaccine for himself?
I think your question, your two questions are actually one. So let me explain it. The human papilloma virus is an ST. It's an STI, or it leads to STD eventually. And now there are different strains of this virus. There's strain 1, there's strain 6, there's 16, there's 18. Now, the strain that lead to
Cervical cancer.
is actually strain 16 and 18
Yes,
majorly,
you
and
said
that's
so.
what you have several risks for. But for other things it can cause, includes you can get cervical, genital warts and all that also from this HPV.
Can you explain what genital warts are?
What? It's like a growth.
It's like a growth.
Yes, on
your
genital
genitals.
regions. Yeah. So you can get all that
Kinda
also
like a
from
boil,
HPV,
but not
like
really.
boil. Yes, you can get all that also from HPV. So for
But
male,
that's not the one that is
no,
that
that's
leads
what
to
you
cancer.
can see more. No, it doesn't lead to cancer. It's a different thing entirely. So that is the one you see more in males.
Okay.
Males usually come down with warts. Female also come down with warts as well. But for cervical cancer, it's only females. Okay. If you're a man, you don't have a cervix, so you cannot have cervical cancer.
Yeah.
So, but like you said, HPV can be transmitted. Yes, male can give it to females, and a male can have strain 16 and 18 as well, but it will not develop cancer. But it gives the virus to a female, and the female now
That
can
he has
develop
unprotected
cancer.
sex with.
Yeah. So that's it. People can transmit the HPV, so don't make the mistake, not the cancer. It's now the HPV being a woman with other factors. Not every woman that have the HPV will develop cancer. That can lead. So if a man, your vaccine is not cervix. But in some countries they're actually giving it also to male, maybe to also prevent
the spread of the virus.
So the one they give, for instance, in the US, they give what called the Gardasil. That has up to 5, 1, 6. So that covers also for warts and cold. So they give up to male as well. So, but for the cervix, it's more effective for the female.
For women.
So for you as a man, okay, what you have to do is avoid unprotected sex, not to get the virus. But if you will get it, you can't have a cancer. You can only have warts and all that.
If you do get the virus, is it treatable? Like if you get genital warts, for instance.
Most diseases are treatable. For instance, viruses, yes, many of them are treatable. But treatment are usually more tedious, and sometimes you cannot be. For instance, talking about hepatitis B. No, hepatitis B, people that are infected, they get treated. I was on the show, I talk about it, and a lot of people after that went to do their test, and some of them came to us, treatment, and some of them are now negative. But it depends. Some people it took 3 months for some people 6 months. Some people will take up to 1 year. Some people might take up to 5 years to get cured. So that's why I am a preventive physician.
Yeah.
I talk prevention all the time. Why waste 5 years treating something if
When
you
you
can
could have
prevent it?
prevented
Yeah. So
it.
I want people to think prevention. When you come to health, when you think about me, think about prevention.
Okay.
That's it for me.
Now, this year, the theme for World Cancer Day is I am and I will. You're wearing a hat that even says
Yes.
hashtag I am and I will. What does this mean to you?
That's a 2-year plan. The UICC, which is actually the umbrella body for the cancer thing, supported by WHO and all that, came up with that team. Now, that team is asking people to make a commitment, okay, to the cancer cause, especially to the preventive part of it. And that's why the word come, I am and I will. Okay, think about yourself first, and then what you will do for others. That's what we're talking about. So for yourself, how to prevent cancer in yourself, think about yourself, and then for other people, for your family and your relatives, your loved ones, and for the world entirely, what are you doing to prevent cancer? Okay, you think you want to be comfortable. Personally, this is personal for me. When I go and I see people, maybe in the vicinity, everybody, there's no power supply, and then one person, if he's a rich man, gets one big generator with so much smoke booming into the atmosphere. I think those people are being wicked to the community, and that's my personal opinion, because I see that I will actually prefer that you stay in that darkness, everybody, than pollute everywhere. You are polluting everybody, but only you is getting the electricity supply. But maybe Nigeria should get better as well, so that people can. So that's one of the things that we are looking at. So in the environment, let's reduce environmental pollution, and now we'll get exposed to things that can cause other people damage.
So I mean, I know you don't like to talk about government, but you do see that in all of the conversation that we've had this evening, if government did even half of what government is supposed to do, we may be able to reduce drastically the the number of cancer presentations in Nigeria.
Of course. I just told you about China, and I'm really impressed. Forget about all the things they do, but look at the government. Look at somebody being in hospital in less than 2 weeks. Oh, wow, this is something.
It is
Look at the way they curtail. No, this some governments are working, and I think we should learn. But I think I don't know. I'm not a politician. I don't want to get to that place. But the truth is this: without political will, nothing will happen. And we can see more of that even in healthcare. If you talk about healthcare, talk about all the grammar and all that. If there's no political will, all the thing I'm talking about is wasted, because after everything, one policy of the government can even cause problem for you. Look at in 2014 and the Ebola thing. Imagine if the Ebola came in through other states in Nigeria. And that's why no matter what, I'll give credit to Lagos State any day. Especially for 2014, they won my heart because they did a lot of things to help us. And first consultant, we have to give credit, and to the late legend, Dr. Aghogho, who stood as a ground. These are people that we should immortalize. These people saved us because we have been in trouble. Now, we knew that this virus was there. We knew that people could come in with it, and we have somebody coming in from a place that have been infected. And we have all the professors, and we all experts are everywhere. We know what should be done. But did we do it? No. I was in the airport, and I can tell you a few things happened. I can't even tell you everything. I remember the first time we went there. Everything. I was at the airport initially. We had nothing to work with. I was just there with screening passenger, and I stood my ground. Everybody must be screened. But you see some people come, they say they are big madam. Big I remember one of the governor's wife. I will not mention her name for today. I tell people about her. I was very upset when I heard. She refused to be screened. She felt she's the governor's wife. She can't be screened and all that. And this is not done. And then I remember there was an hair hostess that came in, and she was having temperature spike. And I was this Musino person on ground, and I insisted she cannot go. She has to be separated. And she got upset, and she started writing petition against me. And I stood my ground and said, I'm going to stand there. This is national call. This is not about who you are. So these are the things. We can do things for ourselves. If we've done all those things well, we have not had Ebola. And now, I'm not sure we are doing enough. I'm doing a few things, spike here and there, but we should do more. Because I know in some country now, even when you come down from anywhere, they are checking properly and all that. But I hope we are doing enough of that. Not the day we have one case, everybody start running scatter. Yeah, this is where the thing is.
Dr. Makinde, thank you so much for your time. By the way, in the time that we've been having this conversation, 10 Nigerians have died of cancer. So let's do all that we can to fight this monster. I am Sandra Ezekwesili. Thanks for talking World Cancer Day with me. Thank you for being part of the show on Community Report today when we took your reactions about the ban or restriction of movement for Okada and Keke in certain parts of Lagos. Thank you also for being a part of the Big Three, where we told you that the Lagos State government demolished Katangoa Market. We brought you reactions as well on the Big Three on the Okada ban, and we told you that the Inspector General of Police said that community policing constables will not be paid a salary. And of course, our newsroom bringing you all the amazing updates from the world of business, sports, entertainment. We're handing you over right now to Godwin Asuko for the news at 6. After the news at 6, Rufai will be here for conversations with Rufai. Don't miss that. I like to talk online every time. So find me, Sandra Ezekwesili, on Twitter, Facebook, Instagram. You'll find me. You can send a request and we can chat away. Until tomorrow at 3:15 Lagos, those were your hard facts. Good night.
This is Hard Facts.